Hi, everyone. Welcome to the Unison Community podcast. I'm the host and founder of Unison, Gabriela Newell. We hope you'll continue the conversation with us at unisoncommunity.com. Hi, everyone. Welcome to the Unison podcast. I'm Gabriela Newell, and I am your host. As mentioned in last episode, today we are really excited to welcome Shelza Rivas, and I will just introduce her briefly. Dr. Rivas is a board-certified women's health nurse practitioner and an adult gerontology primary care nurse practitioner. She is Director of Global Partnerships and teaches in the Women's Health Gender-Related Nurse Practitioner Program at Vanderbilt School of Nursing. She is also co-faculty advisor for the Hispanic Latinx Student Nurses Affinity Group and Nurses for Global Health at Vanderbilt University School of Nursing. Dr. Rivas has experience in leading global health-related projects in Latin America with special focus in Guatemala. Her areas of clinical expertise are contraceptive counseling, infertility, and common gynecologic issues. Her local volunteer activities have included provided education on breast and cervical cancer screenings within diverse communities in Nashville. She's originally from Lima, Peru, and has been in practice since 2015. So welcome, Shelza.
Thank you so much for having me today. I'm excited to join you.
Yes, and we're excited to have you. You know, when the introduction is a mouthful, that it's someone very impressive that
I
we have on the call.
know. And I'm over here, I'm just like, oh my gosh, we need to condense that maybe a little, but no, thank you for reading all of that. And also, gerontology is a hard word to pronounce, and so is gynecologic. So impressed that you were able to just woof.
Oof, well, you know, it definitely I practiced a little bit before, but here we are.
It's a mouthful.
Well, and I just wanted to detail how we met because it's funny, we both went to Vanderbilt, but we never met there. We met at the name of the department is the Center for Latin American and Caribbean Studies at Vanderbilt, and we were celebrating the anniversary. It was the 75th?
I believe so, yes.
Yes. And so we sat on a panel next to each other, and then she introduced herself as an OBGYN nurse. I was sitting next to you, and because kind of my ears perked up because I had this idea, but I hadn't really told anybody yet. So, yeah.
And that was a great panel too. I think it was, you talk about networking events, and it's, even though we were all from Vanderbilt, we all ended up doing different things. And so coming back to that, it was really good to connect. So I was excited to hear about your idea, because then afterwards we had that little reception, which was really great. And you told me about this, and I was like, heck yeah, let's do it. Let's talk about these important topics.
Yes, and you're the first person in the field I told about this idea, and I was a little bit nervous because I was like, she's either gonna love it or hate it, but here we are. And so talking to you gave me the confidence to really kind of push through, so appreciate that.
That's awesome. I love that. Yeah.
And so I know we just introduced you kind of at a high level, but I'd love if you could share more about yourself, your professional career, areas of focus.
So I've been in the US. We are going to celebrate in about a month our 30-year anniversary, because I am from Lima and I came to the US when I was 5 years old in 1995. And so we are headed to a big celebratory event. We're not quite sure how we're doing it. And it's myself, my brother, my other brother that was born here, and then my parents. And we moved to a very small town in Tennessee, Middle Tennessee. We lived all over Culleoka, Thompson Station, Columbia, and landed in near of Nashville, Brentwood. And my dad as a horse trainer, that's how we ended up in the US. And so I lived on a farm, always with a lot of land, a lot of animals. But we just grew up as a very small unit as a family. And that's what really has guided me as a person, but also as someone that has chosen a profession that works with people and caring about people in general. But then I don't people ask me, it's like, "How why women's health? Like, what is it?" And I truly cannot pinpoint where that started or how that started. I've just always known that I've had an interest for it, and so that ended up starting my track of, do I wanna be an actual physician, an OBGYN physician? But then I learned more about nursing school and just wanted to maybe take that route, a little bit less schooling, and the lifestyle of my profession kind of better aligned with what I wanted to do. So that's how I ended up choosing my specific specialty, and the gerontology primary care part I added on because I wanted to be able to do sort of full scope care for people. I only see women now in my practice, but with my certifications, I'm able to see men and women above age 13. And so providing that full spectrum of care was really important to me when I was in school. And even though right now I just do women's health and primary care for women or anybody with reproductive organs, really, female reproductive organs, they're the people that I ended up really envisioning myself working with. And yeah, professionally, I love what I do. I teach as well, and I never saw myself teaching ever. And that came early in my career, and it was very exciting, nerve wracking, but exciting, and now I get to do a little bit of everything. So I patient care, I teach, I also get to not dabble, let's take that back. I'm directing a global program at the School of Nursing, which is so cool. So I'm able to do a lot of things with what I've accomplished, and it's really great.
That's so amazing, and I love that you're getting to do what you love to do, and it's amazing that, you're able to help others. And I just wanted to ask if you could explain to maybe some people who are less knowledgeable on the medical field and professions in the field, if you could explain, gerontology a little bit, what that means?
Sure. Yeah. Well, we can even take it a step back. So, what differentiates me as a women's health nurse practitioner between me and an OBGYN physician? So, we are both healthcare providers, but as a nurse practitioner, my schooling has been more on a limited scope as far as I don't do surgery. I, as a women's health provider, also do not. I know it's deliver babies, but we say catch babies. I don't catch babies, so I will do everything for women, including prenatal and postpartum care, except for the actual catching, delivering the baby part. And then the adult gerontology part is that I'm able to take care of patients across the entire age spectrum up until 65 and over, which is really great. So we're in women's health, menopause, osteoporosis, any type of complications that way, but then also chronic illnesses like hypertension, high blood pressure, diabetes, things like that, that you would see like a primary care for, but at a level where I do have specific training for our older population. So it really broadens the care I'm able to give for people, which is really nice.
That makes a lot of sense, and that's, really exciting to hear because just in conversations I've had with people of all ages, I feel like the topic of menopause comes up a lot, and
Hmm.
there's whether it's before you've hit that period of life, just the uncertainty of it, or when you're
Yes.
actually there and questioning what's happening, and so, I mean, that's definitely a topic that I'm hoping the
Yeah.
website can help address, just people
Yes.
sharing their experience because it is something a significant portion of the population does
Hmm.
experience.
Hmm. That's right. That's right.
You have such an impressive resume, and I just wanted to ask, were there any barriers to getting to this point? I mean, you already had to adjust to moving to the States to begin with as a kid, but is there maybe a person or mentor who helped you get there?
Yeah, and I've been asked that question in different iterations in the past, and I keep saying the same people over and over because were instrumental. Starting off when just being able to even realize that I could go to college. I didn't. I think I come from a very working family, and those familiar with Middle Tennessee, I said Brentwood, and I think that gives a connotation of it is a very wealthy area. It's an affluent area. But my parents, my dad in particular, being a horse trainer, we lived on the farm in Brentwood, but did not live in the way that you would expect. But he was the one that was like, I think you should go to college because I don't want you to end up working in, I want he from the get-go was, I need and I would like for you and your siblings to become professionals, whether that be in some type of education, but something that is going to give you financial stability. So I've always had my dad's voice at the back of my head guiding me through all the decisions that I've made. So he has been the number one. And my mom, of course, supporting me throughout all of that, being a really, really awesome mom. And so both of them molding us, myself as the oldest, into the career path. But then in high school, I had a wonderful teacher. His name is Dr. Thompson, and he was the one that recognized that he was a Spanish teacher. So he's like, I know you speak Spanish, but how can we further that for you? And really opened up the doors because I was thinking, I finally was like, okay, I'll go to college. And I was thinking, oh, I'll go to, community college and whatnot. He's like, dream bigger. Let's think about bigger. Let's think about, and that's when Vanderbilt came into play. Let's think about Vanderbilt. Think about Duke, Emory, all the Ivies. And I was like, oh, me? No, there's no way. But he was the one that pushed me academically, but also pushed the boundaries of my own thinking as far as like my ability to succeed beyond just high school and being able to attain degrees higher because he was a PhD. He said, you could do this too in whatever you want to do. And I couldn't even fathom what that looked like. I was like, I'm just trying to make it to high school. But
Yeah.
he was really someone that recognized that the potential and the ambition that I maybe didn't quite see in myself when I was young. And then got into Vanderbilt, went through undergrad, went through the nursing program. And it was in my nursing program that I have had cheerleaders, my faculty that were my professors that I now work with, which is wild. It was a really weird sort of like, when I started teaching alongside them, I was like, this isn't real. This is what is happening. But they were the ones that there's a difference between sort of realizing your differences when you are younger. As far as for me, it was the way that I looked, the color of my skin, my background, my as compared to my peers, maybe my wealth, things that I thought made me less than. And then when I was able to get into college and more so into nursing school, those qualities that I thought made me different and potentially less than were being celebrated because there were not people that had all the things that I had, those qualities that were achieving maybe higher degrees or even going into healthcare. So being able to represent that population then became something that was highly coveted. So my professors, I'll name them because I will be sending them this episode to say, I love you. Abby Parrish, Karen Handy, Pam Jones, Jenny Moore. Like these are my faculty that from a student, they recognized that they, I was unique in those aspects and then really, really championed me and advocated for me to get my doctorate degree. And then, really inspired me to then go into teaching and really also, I want to say advocated and championed, but just fought for me. They really
Right.
did. So those are all the people that I could really identify at every sort of point in my life. And they are still here today. And I appreciate them so much.
Amazing. Well, first of all, thank you so much for sharing that. I feel like it's so rare at a young age to have these sort of mentors really advocating for you, but also it's impressive on your part too, just, having the ears to listen and take them seriously. I think at a young age, sometimes you think, well, I don't know if that's right. I don't know if it's right for me. Our frontal lobe is not fully developed in
Oh my
high
God.
school. So, we're not
Yeah.
always making the best
Yes.
decisions, but it's so powerful to have someone tell you that your dreams aren't big enough. And I feel like
Yeah.
that's not even something I even started considering till way later in my life. So it's so
Yes.
nice to hear
I
that
got
you had
really
that.
lucky. Yes, I got really lucky, and I think that it was perseverance from those people, because I did was like, but it was that consistent, no, you do. And eventually it stuck. It kind of pushed through and it worked out. So
Yeah.
yeah.
Yeah. Also, side note, the reality of being the native Spanish speaker in the high school Spanish
It
class
is.
is so real.
No, and I think, I remember my guidance counselor at the time, they had to review or confirm classes or something, I don't know, and he looks at me, he's like, I saw that you're taking the easy classes, huh?" I said, I tested out of all the level 1 through 4, and I was an AP, but I was like, "But I still take English language.
Right.
I'm taking the same thing that in my English class, but just in Spanish." Like, it's not easy. None of this is
Exactly.
easy. And a lot of native speakers out there who are listening know that there's a difference between what we're taking in class. Yes, what we're taking
Uh-huh.
in class and being tested on than what our mom and dad and the conversations that we have with our tias
Yeah.
and the chisme and all the colloquial things. And even till this day, I still don't know the grammatical correctness of it all. And I just
Mhm.
write and I say what I feel sounds good.
Yeah.
So
Yeah.
it just is. Yeah.
Thanks for advocating for us there too. Appreciate it. And, kind of going off of that, and you touched on this a little bit, so maybe we can frame it more in terms of how you provide care maybe, or I know you talked about this a little bit on the panel we were on together too, but, like, how you advocate for others who are trying to pursue your field, like, what does it mean to be a Latina in
hmm
women's health?
I think it's powerful. I think it's becoming more common, thank goodness. And we're needed. And in many cultures, ours being one of them, women's bodies, our function, or any topic that has to maybe do with that. There's a stigma around it, perhaps taboo, although I think, and I hope that's improving. But when I was growing up, it was a lot of misinformation, maybe some beliefs that weren't correct. And I felt the need to just be able to, one, destigmatize and take away maybe the fear around it, of talking about our bodies, and what it means to be someone with female reproductive parts, and what to expect and what to look like, and what to look for. And how can we have those conversations with ourselves, but also with other women, other people. And so I feel that me being Latina in women's health, I am a mouthpiece to hopefully start opening up these areas and creating discussion around them. And I'm seeing myself, even though I'm in that field, I'm seeing myself do that more within my own family, like more on a personal level. It sort of opens the door personally to have someone in your family who maybe has received the education for it. It makes it less scary, and you are able to talk about it. But even with my patients alone, there's a lot of, we need to create safe spaces. And I felt like I was contributing to that safe space, so that when someone that very much like reminds me of my mom or my sister, and in their own native language, which I think is huge, who, if you are not part of some culture or someone's culture, there are things that you're just not going to get. And I felt like I sort of had that upper hand in a way, or sort of had that immediate connection with someone that was, doesn't have to be from Peru, but just from Latin America in general, just sort of that sense of kinship, and that literally just understanding of things that go on within our own culture, and that they won't be dismissed. I feel like a lot of people are afraid to bring up the things that they use to maybe address their issues. Like, I remember growing up for ear pain, I remember being laid on one side with newspaper in my ear, and it was lit on fire to decrease the pressure.
Mhm.
And that was like a thing that you use, o pasar el huevo,
Yeah.
who would take curanda, whatever. And those things historically in medicine or in this health space, are not viewed to be the best, or are, or poo-pooed, or knowing those things and not putting those things down, I think also really much opens the door for them to also then continue to tell me other more perhaps sensitive or vulnerable complaints or symptoms that they have. So I think it's being Latina, being a woman, but also the cultural aspect of it all opens the doors to have more meaningful interactions. And if I have more meaningful interactions, then I can invoke trust. And if they trust me, then that means that I'm able to get more positive outcomes in their care.
Definitely. That's very powerful. And I think in many cultures, there's a lot of people who can sort of relate to not being able to have these conversations, or perhaps some of the ways to approach certain situations not being medically or scientifically correct. And I'm really glad you brought up, the thing about topics being taboo, because that's exactly what we're trying to do with this website,
Mhm.
is not make women's health such a secret or
Yes.
so kind of embarrassing to talk about, because it's something that happens to, so we're all experiencing it. All these women are experiencing it. And so it's kind of like, why is it so weird to talk about? Why are we embarrassed or scared to talk about it? And
Mhm.
so I'd love for more of this information to be readily available on the internet. And I think, like you mentioned, kind of sharing experiences is a way to provide more information.
Yes,
But
absolutely.
yeah, I mean, that's really powerful, everything that you mentioned. So thank you for sharing that.
Mhm.
And in terms more of, your experience in the School of Nursing and more as an educator, what are you looking to do in order to help progress the nursing profession, especially in the gynecological space? Are there any sort of specific practices or approaches to care that you find have been particularly successful?
Mhm. Um, so I'm faculty in the Women's Health Gender Related program, and we went through a name change a few years ago to add the gender related part. That's just one aspect of wanting to include everybody. So that was a big step for us. But women's health as a whole has become such a huge, hot topic, controversial topic in many ways, socially, politically, now more than ever. And the policies and the regulations that have come about in these recent years have directly impacted all of us, whether we're nurses, physicians, anybody that's included in the obstetrics and gynecology field. Really, myself included on the personal level. And so it's tough to teach at a time like this. It really is, because we've never encountered it, at least in, in my lifetime, and being in practice for about a decade or so. And so as faculty, we've had a lot of conversations about how to keep hold of that fire and passion all of us individually have that makes us women's health providers. And how do we ignite that fire and keep that fire alive in our students, and then make them advocates for our profession and the care that we provide. And so I guess sort of the overarching goal of our approach to teaching is just being able to acknowledge what's going on, the realities of what this means for our students once they go out into the workforce, knowing that it's not the same workforce that me and my faculty or my colleagues went out. And so how do we best prepare them for that? And the answer is we keep teaching the fundamental concepts of women's and gender related health that are going to remain true until the end of time. We will still review topics that are perhaps are not allowed in some
Mm.
spaces, especially with reproductive care, abortion care, gender affirming care. All of those topics are still important. They're life-saving, which we've seen. We touch still upon maternal mortality, how some certain groups are more at risk. And so we're not shying away from those topics. Our language around it might have to shift a little bit due to more organizational moves and things like that. But our bread and butter, what makes us who we are those fundamental content areas that we still have to continue to teach. And all of us really, we practice in some sort of way or have certain interests within women's health as well. So we've tapped into that a lot so that our students can see how being a women's health provider can also open doors for specific interest areas that they might have, because they're so busy trying to hold a speculum. They're so busy trying not to like stumble, right? See us, they're like, oh wow, she loves to do like I love contraception, I love infertility and whatnot. And so that also is a way to ignite a fire and keep that passion alive. We're also trying to one of the ways that we approach it too is that we are going to be encountering people in a space where you might be the first one that learns about their trauma. You might be the first one that will ever do their pelvic exam and how vulnerable that exam is. You might be the first one that they disclose that they, were assaulted, or maybe they are experiencing intimate partner violence. So there's a lot of things within our field that are really hard. It's really hard to hear. So how can they become people that, we talked about a safe space and what I want to provide, but really how do you create that with
Mhm.
being able to still do the skills necessary as a provider, and so how important that is for to be that person for people. So I mean, there's so many other things, but I think that's sort of the gist of it. Being able to also acknowledge that even it's like the I'm you can probably glean as far as how we're talking and whatnot. Like, I'm very much like an advocate for reproductive justice and having access
Mhm.
to all of those things. But we have some students that are maybe of different backgrounds who hold different beliefs. And so we're also telling them you have to be open. Not everybody's going to have that same fervor. Not everybody's going to want to hear about the birth control that you want to give. And so
Right.
how can you balance that too?
Yeah.
Being remaining open, remaining curious, and then staying abreast of what's going on so that you can be able to provide care in the best way that you can.
Definitely. Well, first of all, I got the chills like when you were talking about all of that. So thank you for sharing. I do think, practicing in Tennessee is very different too, and that's like
Mhm.
the first thing. I mean, I grew up in the Northeast, and so when I went to Vanderbilt, I was like, this is actually truly a very politically diverse place.
Yes.
Like I felt like you had a lot of people from the North, but you also had a lot of people from the South, and I'm from Boston. I mean,
Oh my goodness.
you
Completely
know,
different.
very different. And so but I think there's also value in kind of seeing those perspectives so you can better fight for what you believe is right and
Yes.
rationalize and teach. And so, I mean, I think what you're doing is so important, especially being in Nashville. And thank you for sharing all of that. And also what you were saying about the pelvic exam too. I mean, this didn't even cross my mind at first, but I think most women can probably remember their first pelvic exam.
Mhm.
I mean, it's like it's an experience. I mean,
Mhm.
not and it could be a good one or a fine one, but it's
Yeah.
not usually a great happy one. I mean,
No,
so,
no.
I appreciate you like taking note of that and kind of saying like, "Hey, I know that this is sort of a a personal experience whether you want it to be or not."
Mhm.
And so just you recognizing that is a huge deal and thanks for sharing that it is something that a lot of practitioners are taking into mind.
Yes. Yeah, I'm pretty big on that. We call that sort of, it's standard practice now, but it is on the vein of like trauma informed care. So that's the perspective that we approach everything with. I mean, it's a must, it's a given for what we do. Unfortunately, you don't always see that, and people don't always experience that. So it is something that we emphasize a lot. The words, the verbiage, the tone, our face, sort of how we even be in the room with people, all of that. We don't want to micromanage, but we want to emphasize and really let them know like all of that matters. And
Right.
not just what you do with your hands, but how you be in the room with the patient matters to their experience.
Definitely. No,
Yeah.
totally. Yeah. And obviously it isn't like a universal experience. I think even I personally, just with different physicians, I've moved around all around the country and stuff. So it's always a
Hmm.
different experience, but it's nice to know
Yeah,
that that's kind of part of the education that you are involved in. So,
for sure.
and I know we kind of talked about like being in the current times in women's health and the political implications, but in terms of kind of innovation or exciting things that are happening in the field, I mean, what change or kind of new topic or anything that's going on in the field is exciting you or inspiring you most right now?
Yes, I will say there's finally been some exciting, and I say finally because women's health research around women's health is severely underfunded,
Mhm.
across the board, and even more so now, unfortunately. But I was trying to think of like what has changed since graduated, since I've been done or in the past 10 years rather, and two things have really changed that I think are can be life-changing for some people, or at least positively impact how they approach their women's health care. So one thing would be the frequency of pap smears that people can get. In the past, it used to be many years ago, it used to be you had to get your pap every single year. And it was like I don't want to do it. I don't want to do it. Right. And so now, because of research, women, anybody with a cervix uterus, can go up to 3 to 5 years without ever having a pelvic exam. And so when you go get your well woman exam or your well person exam, if you're not due for a pap and you're not having any issues, you don't have to get a pelvic exam if you don't want to. And that's a
Mhm.
big relief, because the amount of people that are psyching themselves up mentally for an appointment to see me, thinking they're going to get a pap, and then I tell them, "Oh, you're not due for one." They're like, "Oh," you can just see the relief, right? And so, based on the research that we've had, we are able to extend that, which is really nice. So every 3 years from 21 to 30, and then every 5 from 30 up until 65. So if, given all is normal and there's no issues, of course, if you're having issues, then that changes the game. But that's been one thing that provides a lot of relief for people, that I feel like that's been really, really nice. And then the other thing has to do with IUDs. So in the past 3 years, 2 years, our Mirena IUDs have been extended from 5 years to 8 years.
Oh, wow.
So pain and the insertion of an IUD is huge right now. One, people are starting to show on social media what that insertion is like, and it's blowing people's minds. And two, they're talking about the pain around the procedure. And so if I'm able to tell someone that they can have their IUD for 3 more years, also they're like, "Oh my God, that's amazing." They're so excited, they're ecstatic, which is wonderful. That is a relief. And there's also been development of smaller IUDs around my time, a little bit before my time as a student. There was only two, hormonal, non-hormonal, big size, and that was it. And now there's sizes for those who haven't had children or with a smaller uterus. And so those are the biggest things that I feel like are so important and so impactful, because it can decrease any risk of re-traumatizing someone through a
Yeah.
pelvic exam or through a painful procedure. It also allows on the contraceptive reproductive end, if I can keep this IUD in for 3 more years and not have babies, that means I can go back to school. That means
Mhm.
I can maybe allow my body to heal a little bit more before I have another baby. That means maybe I can leave my partner, because, give me 3 more
Mhm.
years. I can, do whatever I need to do if you're in an tricky situation. Well, that means I can go to Europe over the summer for 3 years or for whatever and not have to worry. Like, it opens up
Right.
these doors for people in a way that we don't really get to see or really hear about. Talking about how traumatic a pelvic exam is. Man, if I don't have to get a pelvic exam because I don't need a PEP. And so sometimes it is, when I'm teaching in clinic and students are doing their thing, and we do, listen, heart, lungs, all of that. We do a breast or a chest exam, and then nothing. It feels almost wrong, because as women's health providers, you automatically connect pelvis to what we do. And so it's a lot of teaching our patients as well, saying like, you don't need to do this. And some of them are not, they're like, "No, I need my pap review." I'm like, "Okay." We talk about it, we say you don't need it, but they want it, and they'll get it. It's fine. It's totally fine. But having the option, and now that being standard of care. Now, again, not everybody follows that, but our right now guidelines will say that, and I'm very happy about it.
Yes, I can say I am too, and that's why I was smiling when you first mentioned it, because I remember going to an appointment thinking, again, like the psyching yourself up a little
Mhm.
bit, and then when you hear it's not gonna happen, you're like, "Amazing, I'm not
Amazing,
gonna
yes.
do that." But that's also interesting to hear that it is an option, and I'm not sure, like, how much you understand about the insurance side of it, but if I did want to get it, that would be
Mhm.
included.
Yep,
Yeah, okay.
yep, yep.
Cool.
That's one thing about insurance, and then we can talk about that as all at nauseum, because I have a lot of feelings about it. But no, as far as like being able to do that, that's, yeah,
Uh-huh.
unless it explicitly tells us or your insurance tells you that you can't. But yes, it's totally fine.
Got it. Okay, great.
Mhm.
Good to know. So everyone can understand, going into their appointment, what their options
That's
are and
right.
get a sense of, whether they want it this year or not based on when their
Right.
last one was.
Yep.
Amazing. And so kind of, talking about that appointment, what steps do you recommend someone take before, during, and or after the visit just to make it an overall more productive visit? I think, from the patient perspective, we either are like commuting to get to our appointments, booked our appointments out months in advance, and if we really want to make sure we're getting a productive visit from our care provider, I mean, what do you suggest we do?
Yeah. That's a great question, and I love that we're addressing this. I think that of how do I say this? The schedule that providers work on, so like my clinic schedule and anybody else's clinic schedule, it is not built with the patient in mind. And I know it's a hot topic. People come at me. I don't know, but it really is not. We are our templates, which is the appointment times that we're given, the slots that we're given for every single patient, can be as big as 30 minutes, as little as 5. And
Mm,
in 5 minutes, I'm not going to be able to address everything. And so I kind of want to give a little bit of an inside look on our end, how when we look at our day and we see the number of patients that we have and the types of visits that we have is going to influence how we go in a room and then how we're going to address your goals, but also keep me on track. And whenever someone goes in for like their well woman, well person exam, well, first of all, doing a little bit of research if you want to in your area. Going to a provider that your insurance covers would be ideal. And if you're self pay or whatnot, there's resources for that too, or if you're not insured. And in the world that we live in, there's a lot of reviews. If you want to read the reviews and go, I would say go for it. There's a lot, and always taking it with a grain of salt, knowing that there's going to be mixed sometimes too. And then I hate to say it, but sometimes you're not going to click with the provider, the first provider you see. It's kind of like finding a therapist. And of course, I'm not equating what we do with I mean, both equally important and whatnot, with the difference that I'm in spaces in your body that you probably want to feel comfortable me doing that to you, right? Versus
right.
a therapist. But so knowing that you might not gel and it might take a few tries to find a provider, but being ready with all of your, what we call vital signs, your basics. So the things that I'm going to be asking are are you having periods? What are they like? We'll be touching upon your sexual health. Are you having any issues with sex? Are you sexually active? With who? Do you have multiple partners? Being okay with a little bit of the pokey proddy questions, that it's not just because we're nosy, but it's because it influences the type of care, and it also influences the things that we're going to screen you for. So if we feel like you're at increased risk for certain things. And then when you're in a patient room and you're talking with your provider, you want to make sure that you are working with a provider that is engaged and actively listening. Going on the fast-paced nature of it all, we are in there with our computers and we're barely making eye contact, and and sometimes that's because we're running on the clock. But so what's the balance there, right? You want to make sure that you're still being listened to, that your questions are being addressed,
Mhm.
but knowing to set realistic expectations. So if you're going to go in for like an annual well woman exam, then you're likely not going to be able to dig really deep into your, let's say, your breast issue, or your something that people like, it's intermingled with women's health, is mental health. Of course, if
Mhm.
you're in crisis, or if something happens, we're going to address it. But knowing that we're going to address what we call the basics, as far as like, what do you do for this year? How are your periods if you're menstruating, or depending on your age, menopause and things like that. And then if there's room to ask, to sort of delve into a complaint or into a concern that you have, then great. But sometimes there's no time.
Yeah.
And that's where the biggest area of patient dissatisfaction is too. A visit running so quick. And sometimes is the provider not wanting to address it. Like, let's be real. Sometimes it's like, nope, next visit, and not taking into account, like you said, how long they've been waiting for this visit, maybe how far away they've had to drive, the childcare that they've had to arrange, any of those things. And so wanting to not be dismissive, and if you feel like you're being dismissed, then that's probably not the provider for you. But also on your
Right.
end, if you have a lot of things to talk about, that when you go, maybe you'll address one or two, but then allotting time for next time. And we make that decision with you. Like, what is the biggest what is the priority that you have for today? Now that we've addressed all the things that, I want to address with you, and then we can talk about it. So it's a collaborative effort on both our parts. And at the end of the day, you want to leave knowing that you have a plan going forward. So not
Right.
being afraid to ask questions. Everything is on the patient portal. You're able to, like, as far as like the transparency, you're able to see all your notes, your labs, and request things. Ask for the things that you feel like you might need. It gets into a little bit of a hairy situation when someone pulls out a book and like, I want this whole panel of hormone labs. I'm like, okay, wait, hold on. Let's take it back. Let's talk about like why. Let's see which ones would be useful, But ask for for things that you are curious about or the things that you might need. And so making a decision that way between you and your provider. And if you have questions, message them. If there's something in your visit that you forgot to ask about, message them. The turnaround for messages, at least for me, can range from 3 days to 7 days. It's
Mhm.
because we do get a lot of messages. You should always feel comfortable to follow up with your provider afterwards. You should always feel comfortable to ask those questions. And then asking for resources if you need it. Yeah, it's kind of hard to kind of lay out a template to feel like prepared because every setting is different if you're in
Sure.
private practice and things like that. But I would say hopefully that's a good sort of overall review of that.
No, definitely. And I found that super helpful. And, it is also good to get your sort of perspective on it because as a patient, we don't understand the scheduling that's going on behind it. And I know a lot of it has to do with demand, insurance, like all of these factors that you actually don't have control over as a
Yeah,
provider.
it's so
And
frustrating.
and yeah, I do want to provide that understanding to patients as well because I know that there can be frustrations when you're trying
Mhm.
to get the best care.
Yeah.
And I would like to echo what you said about the portal as well. I found that extremely helpful. The nurses at my practice are amazing, really
Yeah.
responsive. And I think that, I mean, kind of going back to the topic of innovation, that's something that's been really nice in the
Oh my
past
goodness, that's right.
5 to
Yes.
10 years. Yeah. So just having that,
Yeah.
not having to make the trip over there
I
is
know it's
great.
yeah, or being on the phone for a long time and,
Yeah.
all of that. It's great. It can be a little, there's also a boundary there because if we're doing like I'm gonna age myself. When you're on AIM, you're messaging back and forth, boo, boo, boo. I'm like, okay, how about a visit? Like, let's sit down and
Right.
talk about this. So there's boundaries to it too. But as far as like accessibility and there's a big thing too about having ownership of your own information.
Hmm.
That was a big move at where I work, where all notes, everything that you done is available to you, and there's a lot of power in that. So if you decide that you don't like that provider, you're able to take all of your information with you and go somewhere
Hmm.
else. When in the past it was a little bit more difficult to do that. So you really do have a lot more as a patient, have a lot more power that way, and so you can make the decisions that are best for you.
Definitely, that makes a lot of sense. And then just touching on the point you made about maybe a more severe issue that comes up, I mean, you
Mhm.
can always typically people schedule a follow-up,
Yeah.
right, to talk about this. Yeah,
Yeah. For sure. And then if I have
great.
time, I will. I was like, let's sit down and chat. Let's talk about it. It's so provider specific too. Everybody kind of has a way that they practice, but it's so present time. What's happening at that time to be able to make that decision.
Great. Yeah,
Yeah.
amazing. I found that super helpful, so thank you.
Good. Good. Good.
And then kind of, just more generally speaking, I mean, is there anything that comes up often, whether it's a patient or a peer that you're speaking to that's a topic or something related to women's health that you wish people knew more about before either they're experiencing it firsthand or kind of like unsure of topics that you wish people were maybe more comfortable discussing or knew more about in women's health?
Yeah. There's a lot that comes to mind. We touched upon the not needing a PAP every year. That's a huge one.
Hmm.
Differentiating between a PAP and a pelvic exam. They're not the same. A PAP is an actual collection of cells from your cervix that we send off to screen for cervical cancer. A pelvic exam is the actual exam that happens. And so when people are like, oh, yeah, I'm due for my PAP, they often are meaning like a pelvic exam, but it's not the same. I feel like that's a big one. And then another one is this is going to No, it's not. It's part of what I do. I'm always afraid to preface like, "This is gonna sound gross, but this is what we're talking about. This is what
Yeah, the
this is
whole
why we're
point.
here."
Yeah.
Um, and I teach my students this, but the vagina is a self-cleaning oven.
Mhm.
And I want you to know that it is okay that if there's a little smell here and there, it'll go through different cycles and different things depending on where you are. And I feel like a lot of the products that are out right now focused on vulval vaginal pelvic health sometimes do a little bit more harm than
Mhm.
good, and they offset everything. So, just warm water, that's it, to cleanse as
Mhm.
far as hygiene, and it'll save you a lot of grief later. That's something that I in the summer people come in and they're like, "Oh my gosh." I'm like, "Well, what have you tried?" "Oh, I've been doing Summer's Eve, blah blah blah." I'm like, "Oh my goodness."
Oh, dear.
And so that's one big thing, vulvovaginal health is everyone is different, but the less products you use, the better.
Mhm.
And then so going back to menopause, that has exploded in the past
Mhm.
year or so. And so has like PCOS, endometriosis, insulin resistance, especially with the use of GLP-1s. But going back to menopause, my mom, for example, and my grandma especially, they're the generation that was very silent
Mhm.
or maybe didn't feel comfortable. So talking about like, what topics, it can be such an insufferable time
Yeah.
for women. It is also very different for everybody. The average age of menopause is between 51 and 52, but people can start to have menopause symptoms that are perimenopause up to 10 years before that. And it can wax and wane. It can kind of crazy bleeding, hot flashes, night sweats, and then we're okay. Oh my god, the brain fog came back and the joint pain and then blah blah blah. And it is a grab bag of symptoms sometimes. And it's not just hot flashes, it's not just night sweats. And so knowing and letting people know that they don't have to suffer through that there are options for it
Mhm.
that we can use to treat your symptoms so that you're more comfortable. I was listening to a summit about 2 years ago now saying, what is the financial cost of untreated menopause symptoms? And they were looking at how women in really high order, really executive level positions were losing those positions or at least not being able to perform their duties as
Mhm.
before because of the discomfort and the lack of quality of life due to their menopause symptoms. And so they lost their job, they got demoted and whatnot. And what were the financial implications of that on themselves and as the company as a whole, losing someone that was like essential, but then all of a sudden could not do their work because of menopause. And we were in the millions. They were in the millions of
Yeah.
loss of revenue and profit. And so we're able now to quantify what untreated these symptoms that are not addressed and then qualify it also, right? By
True.
women saying, "This sucks." And I'm like, "Heck
Yeah.
yeah, it sucks." And so, and being more comfortable, because on the provider end, there used to be, and there still is a lot of hesitancy around like hormone replacement therapy and prescribing that. There's a lot of fear around causing more harm than good. There's a lot of misinformation out there too about how hormones cause cancer. So there's a lot of things to be fielding as far as like, okay, so when we get to treatments, then what is safe and what is not. So thankfully we're getting to a place where it's both ends, right? The patients are being more vocal about how uncomfortable they're feeling, whether it be because they are comfortable saying it to me or what they saw on social media, which is great. And then us being more comfortable feeling like we're equipped or competent to talk about it a little bit more, and then being more comfortable prescribing some of the medications that are out there. So that's a big thing. And I mean, we can go into endometriosis and PCOS, all that. But anyway, all those things. But
Yeah.
menopause is one that is really big.
No, definitely. And I appreciate you sharing all of that. I definitely learned a little bit within just that conversation, but I do have to say I really appreciate kind of more of the discussion around these topics with the popularization of social media, hopefully my website, and then also even just Netflix. I mean, and this is kind of the last question I want to ask you because I remember watching the show Workin' Moms on Netflix, which
Yes.
I love that show. I don't know if
Yes.
you've seen it.
I've only seen a few episodes, but like I'm like, yes, that's accurate.
It's so, and yeah, they talk about menopause, they talk about all these things, and I'm
Yep.
not at that age yet, but I mean, it's so important to know and to see, and I feel like we should be seeing more of it so we can understand because along with all of the how to cope when you're finally there. I think there's also this feeling too of when you actually get there, what's happening to me? Is this
Mhm.
normal? I mean,
Mhm.
and so if we're not talking about it, we're going to think, I mean, the worst, you know? I mean,
So
am I dying? I mean, our brain
absolutely.
obviously goes to so many
Yes.
things. And so
Yes.
it's like just having the exposure of these are symptoms that happen to a person. A, first of all, most important, this is something that happens. And then B, okay, now what are the steps? I'm recognizing what it is.
Mhm.
C, how do I manage it? And
Mhm.
so, yeah, it's as basic as knowing that this is something that happens to people. And I feel like I'm
Mhm.
learning so much every day. And so, yeah, I just want to emphasize the importance of
Oh my
talking about
gosh.
these things.
Yes, yes, because we haven't even touched on the mental health implications of menopause, which is just
Sure.
huge too, and so it's a wild time. I can't wait because
Mhm.
I'm not there either, but I hope maybe by the time that we're ready, there'll be more information, more treatments, and yeah, a little bit more of a way to navigate that.
Definitely, definitely. And then, yeah, I mean, just I alluded to this just now. So, just our last question that we like to ask people are what either books, podcasts, Substacks, websites, maybe social media accounts have you been like reading or watching that you might want to recommend to people who want to learn about more about women's health?
I personally don't really follow any. I hate to say it, I haven't really read any books or podcasts or, and maybe it's because I do it and know and
Yeah, I
and
get
so
that.
I did a little bit of in preparation for this. I asked a few people that were not in my space and even a few colleagues who I'm like, do you listen to any? They're like, huh, I don't. I'm just like, I guess but
Yeah,
there's one or two. So there is a podcast that, and I have listened to a few episodes. Speaking of women's health with Dr. Holly Thacker, takes a very sort of an evidence-based view, but kind of breaks it down into more tangible and sort of being able to process the information on a variety of different topics. Because one of the things that when I see patients, sometimes they'll come with a book or whatever. Well, I read it here, I read it here. I'm like, but who's the source? So that's
sure.
and then I think that's across everything. But when it comes
Yeah.
to women's health and it exploding in certain areas in the way that it does, really being mindful of who you're listening to. And if they're an expert in the field, then that gives a little bit more gravity and weight to their advice. And so being selective that way. So that's one podcast that I feel like it is pretty good. And then there's a book, and this is more of maybe a validation of us as women. It's called All in Her Head. The Truth and Lies Early Medicine Taught Us About Women's Bodies and Why It Matters Today. So, recognizing that from the get go, women weren't included in a lot of research or their symptoms were minimized, how in medicine as a whole, they viewed women's health issues as not important, and then how that's changed, or even flat out lies or misconceptions that a lot of people grew up with believing that then evolved. And so it's demystifying a lot of things. It's sort of giving validation to some people about, like, oh my gosh, I thought that was real, but it's not. And it's bringing the power back into your body to then also, this is a good book too, like if you're looking at how to best prepare for a visit. So why does this symptom that I'm having matter? Like why, it's obviously something that it's making me maybe lose sleep or I can't stop thinking about it. So obviously it matters. And this is why that matters.
Hmm.
Because a lot of women have, like, pain is a big one. Pain in women in general. I think we just have the expectation or even just not even think about having that high threshold of pain, whether it be intrinsically or generationally, or I don't know. But we've heard about pain in African American women, how that's, very much looked over versus other women in other types of backgrounds. And so it's really opening your eyes to the symptoms that you're having and why they're important for you to pay attention for those. Because a lot of big things have been missed.
Right.
It just has happened that way. And yeah, so I really like those two things there.
Sure. Amazing. Well, thank you. I've definitely heard the podcast. I do need to listen to it more and I'll definitely check out the book too. So thanks for the recommendations. And I totally I mean, I'm a city planner and I don't read anything about city planning anymore either. After grad school, I was like, yeah, I'm tired. I'm having
I
people
know.
text me, ask me why their bus is late. I'm like, I don't know, you know?
Well, I know half the time, like when I watch Grey's Anatomy, I'm like, nope, nope, nope. yep, that's not true. That doesn't happen. And so I'm like, I can't. No one enjoys watching it with me, and I don't enjoy watch. So like anytime I'm just like, that's not true, or like maybe I don't know, and that's just me being completely petty and just like whatever, it's like I know best. I don't. I absolutely do not. So I'm like, this is not enjoyable for me. So I'm just
Right.
gonna,
Yeah,
you know,
totally, totally get it.
yeah.
Well, I just wanted to wrap up here and
Sure.
thank you so much. I found this episode so insightful. I learned a lot just in this hour. We really appreciate your
Of
time and
course.
honestly, everything you're doing. Feel very proud to know you and happy that I met you. And I really do feel like you're an advocate for us women. So thank you really for everything that
Oh
you
my
do.
gosh. Of course. No, I'm so excited about this website and about this just opening the doors for more information. We never need to stop talking. We always need to communicate and talk among each other. And then I think this website is going to be a good landing space for people to know where to start if they have a question, and just not being afraid to talk about what happens with us, or have, I don't know, just demystifying a lot of things, taking away a lot of fear, and then teaching people how to advocate for themselves and empowering themselves to do that in a world that is not built for that. Like that is something that I want to acknowledge, in this hour or in my space and in my patient encounter, I can make a difference in the way that I know how. But at a large scale, nationally, organizationally, there's a lot of things going against that, a lot of things going our way,
Mhm.
and it can feel a little bit like, why are we even doing this? But I just want to encourage everybody that we can still make great strides and improvements, and if we rely on each other and we are informed, and just being there and being proud of the things that we're able to do with our bodies.
Mhm.
Whether or not you wanna change it, I don't know, but just being here, and yeah, I'm excited to have spent time with you today.
Yes, thank you so much.
Of course, thank you.
Hi, everyone. Thank you for joining us on today's episode of the Unison Community podcast. As a reminder, the information shared in this podcast is for informational and educational purposes only and is not intended as medical advice. This content is not a substitute for professional or medical diagnosis, treatment, or advice. Always seek the guidance of your physician or other qualified healthcare provider with any questions that you may have regarding your health or medical condition. Never disregard professional medical advice or delay seeking it because of something you heard on this podcast or read on the website. Thank you again for being a part of our community, and we hope to hear from you soon. Does your organization support women's health, empower women to better advocate for themselves, or to understand their bodies? Please reach out. We'd love to hear from you, whether for sponsorship, partnership, or just to connect.